Hey guys, I'm gonna talk to you guys about the APGAR score. So in our book, I found it a little confusing with the table that they put on there. So I went ahead and looked up different videos to help me better understand and help me kind of memorize how to use this table. So the easiest way I found was to break it down. So APGAR. A is for appearance, so that would be the skin color. P is for pulse, so that would be the heart rate. G is for grimace, reflex irritability. A is for activity, which is muscle tone. And R is respiratory efforts. So I noticed that it's not very likely for your child to be born with a 10 APGAR score, just because babies do tend to be born with something called acrocyanosis, which is your hands and feet are blue, but your body's pink. And it's normal most of the time. So the APGAR score there is a 0, 1, and 2. For each of these categories. So for appearance, skin color, it would be a 0 if your baby's blue and pale all over. It would be a 1 if it has acrocyanosis, and then it would be a 2 for pink all over. The pulse rate, it would be 0 for absent, 1 for less than 100 beats per minute, and then 2 for greater than 100 beats per minute. Then the grimace, the reflex irritability, 0 would be for no response to stimulation. 1 is for grimace but no cry, and then 2 would be for cry. So activity would be muscle tone. So 0 would be none, flaccid. 1 would be some flexion of arms and legs. And then 2 would be arms and legs are flexed. Respiratory rate is the effort. So 0 if it's absent, 2 if it's 1 if it's weak and irregular, and then 2 if it's strong and vigorous. And these are performed at 1 and 5 minutes after birth. And it is repeated again if the score is less than 6, and this will be repeated at 10 minutes. So the interventions that I found were, if the baby's APGAR score is from 7 to 10, they have a routine post-delivery care. If the score is 4 to 6, some resuscitations measures would be needed. For example, some oxygen, suctioning, stimulating the baby to cry, maybe some back rubs, trying to get them woken up basically and alert. And then if the baby's 0 to 3, then full resuscitation will be needed. I was able to come up with my own little scenario or example of how to figure out a APGAR score. So say my baby was born with blue hands and feet, but the body was pink. So that would be acrocyanosis, which the score, I come look over here and the score says it would be a 1. So then my pulse rate, baby's pulse rate would be greater than 100 beats per minute. Say it's 140. Then I will come up here and look, and that would be a 2 because it's greater than 100 beats per minute. So that's a 2. Then we go for grimace, a reflex irritability. So my baby's crying and actively moving, so this would be a 2. Then in activity, the muscle tone, arms and legs are flexed, so that's also a 2. And then for respirations is how the efforts of the respiration. So the respirations are weak and irregular, therefore it would be a 1. And that will tally up to an 8. So this is just something, it's really helpful if you write it down and just remember that it's appearance, pulse, grimace, activity, and respiratory, and that will help you tally up your score. And this is the best I found, and it explained it fairly well. Thank you.